See, the nose has some very important functions, and among them are to warm the air that we breathe, to humidify the air that we breathe, and to filter the air that we breathe. And to achieve this, the nose has a very profuse blood supply to warm the air that we are breathing in. And it is this profuse blood supply that can sometimes cause nasal obstruction. The blood flow to a particular part of the nose, which is called the inferior turbinate, can vary a lot, and then there can be difference between the two sides, so that one side may appear more blocked than the other, and that's called the nasal cycle. So yes, this obstruction can be due to blood flow, but in addition to that, it can be due to several other factors as well. There are several causes for nasal obstruction. Nose can be blocked when the mucosal lining of the nasal cavity is swollen, and that can be due to allergies or to pollutants or some irritants that the patient may be breathing in, or it can be due to some structural abnormalities inside the nasal cavity. For example, a deviated nasal septum, enlarged turbinates. The patients may be having polyps that are obstructing the nasal passages. Uncommonly, there may be tumors, etc., going inside the nasal cavity that can cause nasal obstruction. So, there are several causes for nasal obstruction. Yes, it can sometimes be serious, because if the nasal obstruction or nasal blockage is to the extent that the patient has to resort through mouth breathing, it can be serious, because when you breathe through the mouth, you are breathing in unfiltered air and unhumidified air, and that can cause chest infection sometimes. In addition to that, some patients with nasal obstruction may be having obstructive sleep apnea. Now, obstructive sleep apnea is a condition whereby the upper airway shuts off when the patient goes to sleep, as a result of which the oxygen levels in the body fall, and the brain it triggers the brain to wake the patient up, and obstructive sleep apnea can be a serious problem, which can sometimes be associated or be concurrent with the nasal obstruction. See, the nose is divided into the right and the left by the nasal septum, which is usually in the midline. So, you have the left side and you have the right side, and this nasal septum basically comprises of cartilage in front. The front part of the nasal septum is formed by the cartilage, whereas the back part of the nasal septum is formed by the bone. It is supposed to be in the midline, but it is rarely in the midline. It is always deflected to one side or the other. But when the septal deviation is so severe that it is very severely deviated to one side, it can cause nasal obstruction. So, a deviated nasal septum is just a term for a septum that is not in the midline, but has deviated to one side or the other. Nasal turbinates are actually projections of from the lateral wall of the nose. They are shelf-like projections from the lateral wall of the nose. There are three of them. There is the inferior turbinate, which is the lowest among the three. Then there is the middle turbinate, and there is a superior turbinate. Among the three, the lowest or the inferior turbinate is the most important, because it has a very profuse blood supply, and it is responsible for warming and humidifying the air that we breathe in. Now, it also contains a lot of cells that trigger the allergic response when we come into contact with something that we are allergic to, and that would be sneezing, running nose, and nasal itchiness. Adenoids are lymphoid tissue behind the nose, right here. This is basically, adenoids can become very enlarged, and they can cause nasal obstruction. It is particularly common in children, and it can also sometimes block the eustachian tube, which is right here, and the infection from the adenoids can actually extend from the eustachian tube into the ears, into the middle ear, and cause infection of the middle ear. This is also particularly common in children. In adults, the adenoids can be enlarged, particularly in smokers. The treatment for nasal obstruction will depend on the cause. For example, if there is patient has allergies or just enlarged turbinates or small nasal polyps, then we will treat them with medications like intranasal steroids and very occasionally a course of oral steroids. And if the patient has a deviated nasal septum, then a septoplasty will be necessary. On the other hand, if the patient has a very severe grossly enlarged nasal polyps that are causing nasal obstruction, then surgery will be necessary as well.